Hey, my name's Allison. I'm on day 3 of a post-surgery Achilles tendon repair and thought I would share a little bit about my journey. I was injured on October 3rd, which is almost a month ago now at this point, when I was being chased by a scary dog, and I turned to run from the dog, which I know you're not supposed to do, but in the moment when it's snarling and growling and barking and coming at you full speed, it's terrifying. So I did run and I tripped and fell, and that's when I tore my Achilles. Luckily I didn't get bit by the dog, though in hindsight I'm now thinking I wish I would have just taken the dog bite because it probably would have been a faster recovery, but regardless. So I actually didn't have pain right away. I was more worried about my knee that was swelling because I fell on my knee. And so I just put ice on it, and then about 8 hours later, I'm thinking something does not feel right, and I'm not walking well. And so I thought I really should go have this checked out. And I was really surprised when they said I had torn my Achilles tendon at the ER. They set me up with an orthopedic appointment the next day, and I went, and the orthopedic surgeon said, yeah, it looks like this is probably going to be a tear, but we need an MRI to confirm. And but we can't get you in for an MRI until 2 weeks. So I'm like thinking, oh my gosh, it seems like so long, but I'm just following the rules because I've never been through this before. So didn't really understand what all was involved. So I was in a boot and supposed to be non-weight bearing. I did get a knee scooter, which this is my knee scooter right here, and it has been a true lifesaver. And then I use this crutch to kind of help me get around a little bit and transfer from point A to point B. This is my current situation with my bandage. It's a splint, so it's a hard splint on the bottom, and then it's a soft splint, or there's just like a bandage up here on the top. So I had the MRI, and then I had to meet with the surgeon again for follow-up, and she said, well, it is a tear like I thought, and it actually is a complete tear. So it's a very large gap that I have. And the location is right behind my heel. So she said, yeah, it's going to need surgery. And so, I was talking with her about the surgery, and I really had done a lot of research by then because at this point it was 2.5 weeks after initial injury. And I really didn't want to do the big open incision. For one, that incision looks scary to me. It's a huge wound potential for bacteria, wound issues to develop, and I really did not want to do that. So I wanted to do the minimally invasive, and she does not do that. So she referred me to someone else in her practice, and he got me in within 2 days and said, this needs to be fixed ASAP. So on Tuesday, I saw him. I did my pre-op and had surgery this past Friday. So within 3 days, I had gone from not knowing what I was doing to having surgery. So far the pain has not been bad, but I have been using my prescription painkillers just to keep that under control, because once that pain gets away from you, it's really hard to get back under control. Wanting to kind of dial that back a little bit. When I first had the injury earlier in October, I did not rest very much, and this time I am definitely resting. I want to give my body the full chance to heal. I do have that's been really helpful. It's a wedge pillow, and has it has kind of an opening, a kind of a divot right there, so I can put my pillow in here and then get my leg up in here to keep my leg elevated. And then at night, I use a pillow to keep so that my leg is above my heart at that point. So at this point, I'm just trying to heal, rest up, and I'm really anxious to get started, and going forward with physical therapy, because I have things to do. Gardening, hiking. I was supposed to be training for a half marathon in January. Obviously, that's not going to happen. So anyway, I just wanted to share my thoughts with everybody, and just say I haven't seen a whole lot of videos with women of my age in their 50s. Normally it's younger people playing basketball or something. And even though I'm active, I am a little bit in my 50s now. So just want to say that, it's quite the journey in mindset, especially if this is a new injury for you. You really have to get your mind right and focus on healing and try and stay as positive as possible, because it can be really easy to get down and get super negative and kind of depressed. Actually, I went through a little bit of that at first. I felt it was so unfair, if my neighbor had their dog on a leash, et cetera, et cetera. But we have to kind of deal with life as it comes to us and just try and stay as positive as possible, because our bodies listen to what we say to ourselves. So anyway, I'm looking forward to November 10th. That is my follow-up appointment to hopefully get stitches out, get the splint off, and get back in my boot, who I have named Betty the Boot, because she and I are going to be good friends for the next few months. So anyway, take care, and if you have any questions, or leave feedback below. Thanks.